generally we are happy with whatever result we have because it has given us some indication of what is happening, and majorly because, when we go about tobacco control in general, we put into consideration second-hand smoke. So if we have not seen people do it, whereas we went around, that's already a score that exposure to second-hand smoke has gone down because it's not being done openly. When you look at Westlands and Parklands, maybe somebody would add to that, but there is a bit of a difference, much as they are together very close. In Parklands, the major consumers of this thing are university students. That's why, and you know how they behave normally, and these are teenagers. So it's a bit different from Westlands, much as they are together. Because when you look at the areas where this was found, then you find that the major consumers were university students from the various universities around there. So there could be another reason. But also in Westlands, as we talk about the high-income cadre, such people tend to be cautious, and then they try to hide exactly what they are doing. They are better informed, and they could be behaving a bit more differently from those of Parklands, much as they are close to each other.
Pilot study that was undertaken in May 30th, 2019, and then from that piloting, the following 2 weekends, we had the actual data collection. So we had each team that visited 33 areas, 33 venues of the 6 areas. And what we wanted them to check was 3 public places. So check the bars, the restaurants, and the nightclubs. And we also checked during peak hours. So we started on Friday, Saturday, and Sunday in the evenings from 6 to some went up to 2 a.m. So these are the areas. We had Westlands, Parklands, Langata, Isiri, Kasarani, and Mathare Valley, but also we added Pipeline because there were some challenges with one of the venues. The overall 82% of the venues that we visited were in compliance, and there was considerable variation, though there was considerable variation among the 7 areas. The highest level of compliance was in Westlands, surprisingly, which was 100%, and then Parklands had the lowest level of compliance, which was 57%. And where we found most shisha use and indicators were in nightclubs, more in nightclubs than the bars. And rarely in the, only 5% was observed in the restaurants. So what were our recommendations from this study? That there is need to increase the surveillance of shisha in public places using a multi-sectoral approach. And we recommend that first is that there is need to train the relevant enforcement agencies about the shisha ban. 2 is to raise awareness of the shisha ban among bar and nightclub owners and managers. As you can see, that's where we found the use and the indicators of shisha.
What I can say is that the enforcement aspect is multi-sectoral. It's not just the enforcement officers or the askaris and what have you. At the points of entries, we have officers who are supposed to be checking on the goods that are coming in. So it's multi-sectoral. The civil society is out there to do the monitoring, give presenters with data, because like now we get to know the areas that probably will have to scale up the enforcement. And as Chabaria said, it's not just about place, it's about time also, because the people who are doing this, they know it is an illegality, and hence they want to hide it. The media plays, we call you, go out there in those clubs, name and shame them.
Kamkunji sub-county basically has made tremendous strides because we've deployed a multi-sectoral approach in terms of shisha compliance. We are working hand in hand with the local administration through our Deputy County Commissioner, the community policing initiatives such as the Nyumba Kumi, in terms of monitoring where shisha is being smoked, and also relaying the relevant information